If you're suffering from shoulder pain, a physical therapist can help. In this video, we will discuss how. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. The shoulder is a ball and socket joint. It's one of the most complex joints in the body with many ligaments, tendons, and muscles attached to it. The shoulder has tendons that attach muscles to bones, ligaments that hold the bones together, cartilage that deepens the socket, the glenoid, and the ball, the humeral head. It has the rotator cuff, which is a series of 4 muscles and tendons, the supraspinatus, infraspinatus, teres minor, and subscapularis, if you're interested in that. And those work together to stabilize your shoulder if you lift something heavy or rotate your arm outward from its resting position against gravity. They help you basically reach your arm overhead and your hand overhead with ease. Now, shoulder pain can be caused by a number of different things. Traumatic injuries such as falls. Injuries to the shoulder can also be overuse or caused by repetitive motions. Some of the injuries that cause shoulder pain include rotator cuff tears, biceps tendonitis and biceps tears, labral tears. A physical therapist can evaluate your shoulder and help you determine the best treatment plan for you. The physical therapist can help you identify the cause of your pain, can also help identify certain imbalances, such as imbalances in the muscles that could be causing that pain. They can develop an exercise program that you can do to help improve the function of your shoulder, including stretching exercises, strengthening exercises, range of motion exercises, and more. The physical therapist will also use their hands to feel for areas of tension and tightness in the muscles around your shoulder. They may have you perform certain movements while they watch how you move, as well as asking about other symptoms and other things associated with your pain, such as neck pain. They may use a variety of techniques to evaluate your shoulder. Again, range of motion testing, measuring how far each joint moves through a range of motion, and sometimes they can use these tools called goniometers to measure range of motion. The physical therapist can determine if there are specific restrictions at any point in the motion to determine and basically compare from before to afterwards to see improvements. They can test your strength, grip strength, rotator cuff strength, scapular stabilization exercises, scapular protraction and retraction, static holds against resistant bands, arm elevation exercises using weights up against gravity or using other various upper extremity muscle activation patterns. Lateral shoulder stability tests, lying on your side, patient raises the arm overhead, lying on their side. Active release techniques, soft tissue mobilization techniques used often with other manipulation treatments. I don't want to get in all the specifics. I hit you with a lot, but there's a whole lot that they do because, again, a lot of times, at least as an orthopedic surgeon, I hear people say, I don't need to do physical therapy. I can go to the gym and work out, but it is not the same thing. And all of those things I just talked about are not really things that you can do in the gym. Again, they will work with you to do exercises to improve your range of motion, to improve your strength, which can be extremely important so that your arm can move through its full range of motion and do everything you want to do, including lifting things overhead, out away from your body or behind your back without pain. They may, again, do manual therapy exercises using a variety of different tools, gliding discs, rollers, and a number of other things. And most importantly, possibly, they will give you exercises and a specific program to do on your own that you can do at home so that you maximize the results of your treatment on the days you're not in physical therapy, maintaining and increasing your shoulder's range of motion, maintaining, increasing the strength between the physical therapy sessions. Eventually, you can transition to just doing the exercises on your own after you've finished formal physical therapy. Again, a physical therapist can help treat shoulder injuries and encourage recovery by helping you with a specific recovery plan. And that can be extremely important, not just determining the cause of the pain, but if there's any other issues that need to be addressed. They're very good at identifying these types of problems and recognize when they can basically treat these problems and help you get better, as well as knowing, all right, something else is going on. Yes, you should see your orthopedic surgeon to make sure that there's not something else going on. Maybe you need more specific x-rays. Maybe you need an MRI. So all of those issues that I talked about, their ability to identify the problems and use all of that information to then work with all those different modalities and strategies to help you get better, and also recognize when a problem might need to be looked at by an orthopedic surgeon, and they can guide you to the appropriate specialist. If you're suffering from shoulder pain, I would argue it's very helpful, important even, to see a physical therapist to determine the best treatment plan for you, help treat the injuries, and encourage recovery with the appropriate recovery plan. I'd love to hear about your experience with your shoulder injury, and if you've seen a physical therapist, leave those in the comments below. Just realize I can't give you specific medical advice, but I'll try to answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start a new live stream, including my Ask Dr. Geier live shows. I appreciate it so much that you watched. I hope this video helped you, and I look forward to helping you feel, look, and perform better than ever.